Caggiano. I'm the Vice President of Research and Development at Acorda Therapeutics. And just want to thank you for having me and let you know how proud Acorda is to be able to sponsor this event again this year. So first of all, I see I'm the only person in the room with a tie on, so it makes me feel a little foolish, but it's okay. So for those of you who aren't familiar with Acorda Therapeutics, we're a biotech company in Hong Kong, New York, which is just outside of New York City. And we were founded by Cohn in the 90s with the mission to develop therapies for spinal cord injury. The company initially was established as a virtual company doing research in several academic labs, including with Jerry Sidler, who you'll hear from next. And then the company really got going when we licensed in a sustained release formulation of formimopyridine from Milan, which is now known as dalfampridine. At the time it was known as fampridine. And we started doing clinical trials in spinal cord injury at that time. We also started doing some trials in MS as well. We got through phase 2 and into what some might call phase 3 trials for spinal cord injury, which unfortunately failed. And we did not see the results that we had all hoped. Luckily for us, and hopefully for the rest of the community, the trials in MS went very well, and we now sell this drug, dalfampridine, under the trade name Ampura. Well, I'll just put a little hitch in our development programs for spinal cord injury. Now that we're able to sell Ampura, and we've developed a real robust and fully operational company, it's now enabled us to put more resources behind the other programs we look at, including other neurological injuries, including spinal cord injury. Right now we have 3 active spinal cord injury research programs, which I'll touch on very briefly. But today we were asked to talk a little bit about our work in chondroitinase and our view on the development of chondroitinase. And before I get started, I'm going to warn you, the presentation is a little different in that mostly what I'm presenting is other people's work. And really, we did this kind of intentionally in that one of our views is that really part of the strength of the field and the potential of chondroitinase is that data has been developed by people all around the world that are completely independent, in completely different labs, and completely different models. And we really think that's a strength of the work. And secondly, most of our work recently has been looking at translational issues like formulation and delivery, and we haven't been doing a lot of basic science on it. So you'll have to forgive me when I show everyone else's work and just a bit of our own, but we do think that's exciting. So if you look at a historical perspective of the development of chondroitinase as potential therapy for spinal cord injury, we go back over 20 years now, and some of the early work from Jerry's lab showing that these chondroitin sulfate proteoglycans are part of barriers that allow the central nervous system to develop properly and prevent or encourage proper synapse formation. Work then went on to show that these same molecules are formed by glia and other elements during the time of injury. And the idea was developed that perhaps these are partially responsible for the fact that the central nervous system neurons don't regenerate very well. And then finally now we're at a point here, and I've shown here in this bottom little clip a recent article from Jerry, which I think will be presenting data on later on, really showing that in highly complex functional systems we can manipulate these chondroitin sulfate proteoglycans with chondroitinase and result in functional improvements in these models. At Acorda, one of the early things that really stuck out for us, like for most people, is a picture. And this is again some work from Jerry's lab and done by Stephen Davies, who I think is also here. And this is some work, and I don't really know how well it shows up, but basically what it shows is that in neurons that are transplanted into injured cords, you get a robust regenerative response, and that this regeneration stalls when it reaches the glial scar and the chondroitin sulfate proteoglycans that are generated around that glial scar. And I think for us and others, this was one of the really early demonstrations in vivo that the chondroitin sulfate proteoglycans have a significant role and perhaps are a great target to go after if we're trying to encourage regeneration. Soon after that, Lawrence Moon did a study where he severed a certain pathway within the central nervous system, the nigrostriatal pathway, and was able to generate a limited but significant amount of regeneration within that pathway when he treated those animals with chondroitinase. And then I think what really was a seminal paper that got the community really excited about the potential of chondroitinase in spinal cord injury was some work done by Liz Bradbury and her colleagues both at King's College in London and at Cambridge University. And she did a dorsal columns lesion in rats with a wire knife, and then treated these rats for 10 days, dosing them every other day with chondroitinase. And what she was able to do was to show that not only was she able to induce a bit of sprouting, but she was able to cause functional improvements in their sensory and motor function. And she demonstrated this by the rat's ability to remove tape from their paws, and as we've shown here on the bottom right, on their ability to cross the ladder. And what she's shown here is that animals that were treated with chondroitinase had much fewer mistakes with their limbs. Another thing that was very interesting about this paper was that the functional improvement was greatly out of proportion to the degree of regeneration that they were able to show, which again introduced the idea that other things are happening with chondroitinase, things like plasticity or formation of new synapses, as well as possibly an anti-inflammatory or neuroprotective response, resulting in very rapid improvements. At the same time, the work from the Cambridge group, they were also working with a group in Italy, demonstrating that indeed there's more going on than gross regeneration with chondroitinase. And this was work published by Tommaso Pizzarusso, where he was able to show that in a rat that's developed past its stage where there's typically a lot of plasticity, that they're able to reestablish a period of plasticity in a nearly adult rat. And they demonstrated this by showing that they could reorganize their ocular dominance columns. And so what they did was they injected chondroitinase into the visual cortex, covered an eye, and were able to then alter where the central nervous system was responding to the open eye. And at Acorda, and I believe others around the world, felt that this was a real demonstration that chondroitinase may be applicable in situations where injuries were long established, and that we could restore the period of plasticity and perhaps allow the established and existing central nervous system to compensate for lost function and injury. We had started a lot of this work at a similar time, and we went to the group at Cambridge and King's College and were able to license patents that they had filed on the use of chondroitinase to treat neurological injuries. And one of the things that we wanted to address very early was, is there also potential for chondroitinase to treat contusion injuries? So unlike most experimental injuries, which are fine sections done with a knife or some sort of wire, a contusion injury is a big, whopping, ugly injury that has a scar that may be 2 to 5 or maybe even 20 times the size of what you see in the scar on a section injury. So we did a series of studies looking at chondroitinase treatment of rats that had suffered contusion injuries T9, T10 thoracic level. And we did 3 different injury levels. We did a very severe injury, a moderate, and a mild injury level. And what we were able to show is that if we treated these rats for 10 days after their injuries, we could improve their motor function as well as their autonomic function in the severe and the moderate injuries. We didn't see significant results in the most mild injuries that we did. So what we've shown here on the left side are open field locomotor scores with the BBB scale, and animals that were treated with either a vehicle, which is the blue line, a non-active protein, which is the green line, or with chondroitinase, which is the red line. And what you see is that there's a significant and sustained improvement in the walking ability of these rats that were treated with chondroitinase. Similarly, and shown on the right side, we looked at the residual urine volumes as a measure of their ability to spontaneously empty the bladders. And what we were able to show is that in animals that were treated with chondroitinase, they had significantly reduced volumes remaining in their bladders. So shown here is a pretty typical response where the animals retain urine, and then they have a partial recovery thereafter, whereas in animals that were treated with chondroitinase, they return to near normal levels. So skipping ahead a few years, another very exciting outcome of chondroitinase research has been data recently showing that even long after an injury has been established, treatment with chondroitinase can improve function in rats. And this is work, again, out of James Fawcett's lab that was recently published, showing that when animals are treated with chondroitinase beginning approximately 4 weeks after their injury, that they can get a robust and significant improvement in their motor function. And here, the data shown is the ability of rats to grab food pellets that are placed in certain challenging conditions, and you see that they're both able to reach and grasp more pellets, and they're able to do that with less mistakes and faster. So in addition now to having been shown in multiple labs around the world that chondroitinase can improve function in several different models of acute spinal cord injury, and now also in models of chronic spinal cord injury, I think it's also important to note that it's also been shown in non-rodent species that chondroitinase can improve function. And about 4 years ago, Dina Allen's lab published a paper looking at fine motor function in cats that had undergone certain sectioning lesions of their spinal cord. And then these cats were treated with chondroitinase that was introduced in a couple of different manners, soaking gel foams, putting them in the lesion, and then applying it around the lesion. And they were able to show significant improvements. And this was really encouraging for the field in that rat motor function is one level of complexity, where the cat's motor function is certainly a much higher level, and also the cords are much bigger. So this was very, very encouraging. So looking at the status right now, we believe that there's clear evidence that chondroitin sulfate proteoglycans are important, that they alter the capacity of neurons to regenerate and undergo plasticity. We think the rationale for using chondroitinase is very strong, and there's data out there that chondroitinase promotes plasticity, regeneration, sprouting. And also we believe that there's very strong evidence, again, that chondroitinase not only can promote plasticity and regeneration, but it can also promote functional improvements, which really are the ultimate end goal of any treatment. Again, to reiterate, we think the fact that these data are derived from labs around the world that are completely independent, and that they're derived from many different species, at least 2 different species, is very important as well. So then one might say, well, with the status and such encouraging data, why are we not jumping headlong into spinal cord injury trials? And I think the reason for that is there's still several challenges that remain. Firstly, I think we all have colleagues that have come to us saying that they've done chondroitinase studies and they don't see any positive effects. And I think that's true, and I think one of the challenges is that using chondroitinase is a real challenge. It's hard to deliver it well, and that's what we're going to address here in a bit. And then finally, if we can overcome those delivery issues and use issues, then we have to go on and really explore the safety and toxicity of the compound, and then move into trials. So looking a bit at some of the challenges. So one of the biggest things that has slowed our progression into human studies is when we look at what happens to chondroitinase when it's delivered to a rat. So this is some data from Liz Bradbury's lab, where they injected chondroitinase at C5. And what you see here shown in green is an antibody that marks where chondroitinase is inactive. And what you see is that the chondroitinase spreads for about 3 to 5 millimeters on either side of the injection. So the injections were done here, and so you see distribution both rostrally and caudally. The top image shows distribution 2 weeks after the injections, and then the bottom at 8 weeks after the injection. Similarly, you see almost identical distribution coming out of Cambridge University, and again, this is from James Fawcett's lab. And in this case, they injected twice, once rostrally and once caudally to the injury. And on the rostral side, you'll see that the distribution is even more limited, and on the caudal side, you'll see that again, they see about 2 to 5 millimeters of distribution from the injury. Similarly, in addition to the intraspinal injections that you see here, they also treated the cord 5 times with chondroitinase, basically bathing the cord. And what you see is you see some rim of darkness, evidence of digestion, but you really don't see any significant penetration into the cord. If you look at this from a cross-sectional view, and these are the exact same animals that came out of Liz's lab, what you see in the left column here is what an animal looks like, or a spinal cord from a rat that's processed to look at chondroitinase digestion without treatment. And then the next column over is digestion when you inject chondroitinase into the ventricles of the rats. And what you see is it distributes somewhat throughout the cord, and particularly around the central canal. And then on the third column is digestion shown when you inject chondroitinase at C5. And what you see is that by the time you get to the brainstem, there's very little evidence of digestion except for around the rim, where presumably chondroitinase had leaked into the CSF. Looking at this at a little higher power, here we've taken the same sections from Liz's lab and looked at comparing intrathecal injection with ventricular injection. And again, what you see on the left side are the rats that had been treated with intrathecal chondroitinase, processed for an antibody that looks at where digestion has occurred. And what you see is there's about 1 millimeter of penetration in from the outside of the spinal cord. And similarly with the intracerebral ventricular injections, you see perhaps a little more penetration, but again, it's limited to definitely no more than 2 millimeters of penetration. So what does this mean for a spinal cord in a rat, and what does it mean for a spinal cord in a human? Well, clearly, the world has shown that this is sufficient treatment to induce changes within a rat. But we're not really interested in treating rats. If you look here, this is some work recently published by Acorda comparing a rat cord and a human cord. And while simple, I think the point is clearly made. A rat cord is about 9 centimeters at most. A human cord is in the ballpark, depending on where you end, of about 30 centimeters. And if you look on a cross-sectional area, rat cords, depending on which section of the cord you're looking at, are somewhere around 5 millimeters, whereas human cords range from 9 to 12 millimeters in diameter. And if you start translating this into area, and math that I forgot from 4th grade, that translates to about 12.5 millimeters of square millimeters compared to nearly 100 square millimeters in the human condition. So looking at this in a length fashion, one of the things that we believe we're doing with chondroitinase treatment is allowing certain plasticity and sprouting within segments, rostral and caudal, to the injury. to compensate for lost functions. And one question is, how many segments do we need to treat to get functional improvement? If you look at a rat, each segment is very small, whereas in a human spinal cord, each functional segment of the cord may be a centimeter in the cervical area to 1.5 centimeters apart in the lumbar and thoracic area. And so then we have to ask ourselves, if we do go forward with spinal injections, is the 3 to 5 millimeters of distribution that we see in the rat cord, will that be sufficient to reach the areas within the human cord that we want to reach? Which leads us to the second question of, can we achieve greater distribution in a larger cord, and how would we go about doing that? So looking again at the cross-sectional area, this is some data published by Cohn in 2004 showing that the human spinal cord ranges at its narrowest in the sacral regions to about 5 millimeters, but most of the cord, the diameter is somewhere between 10 and 12 millimeters. And again, going back and looking in comparison to the rat cord, what we have to ask is, again, is this 1.5 millimeters, perhaps 2 millimeters of penetration around the outside of the cord going to be sufficient really to reach the regions of the cord that we want to reach? I think the data that we've seen particularly recently shows us that this sprouting deep in the gray matter is really where we need to go, and that surrounding a cord with chondroitinase may not be sufficient to reach those areas if the spinal cord itself is greater than 4 or 5 millimeters in diameter. So now that we've covered the bad news, Acorda is not giving up. We have 3 active programs in spinal cord injury that I mentioned. The first, we just licensed in from Medtronic, which we call AC-105. They formerly called NeuroShield. This is a clinical program. It's completed phase 1 trials, and we're moving into phase 2 trials for acute spinal cord injury. We also have glial growth factor 2, which we're now working under the DoD and the SCRP Translational Research Partners Program with Georgetown and NC State. And then finally, again, the Chondroitinase program. So how are we going to overcome these hurdles with chondroitinase? Well, the first thing that we want to do is really ask ourselves, is distribution an issue? Clearly, there's distribution that's seen in the rat, but we don't know what it's going to look like in a larger cord. So we're looking at some pig studies to address this. Secondly, is direct injection into the spinal cord of sufficient quantities of chondroitinase to digest the amount of material that we want to? Is it safe? Are surgeons willing to inject once, twice, 3 times within a spinal cord? And then again, are we able to overcome this in other ways? So can we put chondroitinase into a sustained release matrix or a viral vector that we can deliver to the cord in order to achieve sufficient distribution of digestion? And then finally, if these things fail, what other alternatives are there to manipulate chondroitin sulfate proteoglycans? And then finally, hopefully, we'll get some positive answers from these and move on to manufacturing, safety, and toxicology. So looking first at asking the question, is distribution actually an issue in larger animals? And will it be scaled, or will we still be limited to a few millimeters of digestion? We began to sponsor work a few months ago at a contract research organization to look at distribution of digestion in pigs, which are really quite big. So we're doing direct injections into the spinal cord as well as intrathecal infusions to bathe the spinal cord in chondroitinase. We're working on exploring different volumes of injection and then different units of activity or different amounts of chondroitinase. And if we are able to achieve widespread distribution in these pigs, then we'll go on to look and see if the chondroitinase has done other things that we don't want it to do during those injections. And hopefully the answer to the first question will be yes, and the second no. Another thing that we're interested in are alternative methods of delivering chondroitinase. One of those would be viral vector-delivered chondroitinase. And this is some work again from our colleague at King's College, Liz Bradbury, where she has put a chondroitinase that has been converted to be a little more mammalian-like rather than bacterial-like, and put it into a lentivirus and delivered the virus to animals. And what she's shown here is on the top panel, chondroitinase, and these are the same pictures you saw before, that was directly injected into the cord. And then the bottom three rows are chondroitinase that is delivered by injection of a lentivirus that expresses chondroitinase into the cord. And what you see particularly in the second row and the third row is that she was able to achieve really widespread and long-lasting digestion when chondroitinase was delivered in this manner. So this has overcome one huge problem, and it'll be exciting to see the work that comes out of this. Of course, right now, we don't know how to turn this off. And so I think while it's very exciting and it leads us to new possibilities, it's still not quite ready for prime time. Another thing we're working on is sustained release formulations. So we're working with both other companies and academic labs to put chondroitinase into formulations and matrices that protect it, so that we can put it into the cord and get long-lasting activity and distribution over weeks and months. One of the challenges to this is that chondroitinase is generally very unstable at 37 degrees and inactivates very quickly. So we started a project looking at a molecular evolution of chondroitinase, where we did multiple mutations in all different regions of the enzyme, and came up with a novel chondroitinase that's able to maintain activity when held at 37 degrees. And we're hopeful that this, combined with the matrix formulations, may be a real and practical way to deliver chondroitinase. And then finally, if these methods fail, we're working with companies to develop small molecule inhibitors of glycosylation, so that perhaps if we can't figure out a way to safely and effectively deliver chondroitinase, we can deliver other compounds that will alter chondroitin sulfate proteoglycan content and lead to plasticity and regeneration. So in summary, the Acorda view of chondroitinase and its potential is that we believe there's convincing evidence from around the world demonstrating that chondroitinase has potential in spinal cord injury. We're excited that it's effective in chronic and acute spinal cord injury. We believe there's still issues remaining in how we're going to deliver chondroitinase safely and effectively. And then finally, we want to leave with the message that, hopefully in a few years, I'll be able to come back and tell you we've overcome these problems. But if we haven't, this isn't the only program we're working on right now. Again, we're working on this and 2 other programs to treat spinal cord injury. So thank you very much for having me, and look forward to your questions.
Visit u2fp.org for more coverage from Working to Walk and the latest in spinal cord injury news.